Veterinary Clinic with Suki, our special guest, and Dr. Magda, and we're here to talk a little bit about Distemper. Hi, Dr. Magda.
Hi, good afternoon, everyone. Yes, I'm veterinary doctor in Blois Veterinary Clinic. I work here from 5 years, 11 years experience in Dubai. My specialty is internal diseases and dermatology, Luxembourg University, and I'm as well a member of Royal College Veterinary Surgeon.
Amazing. Thank you so much for joining us. We're very excited.
Thank you, it's my pleasure.
So great. So we've had so many questions recently in light of the recent outbreak of the Distemper virus. And so many people have asked us, what exactly is Distemper?
Distemper is a very contagious viral diseases, and it's caused by paramyxovirus. It's closely related with measles virus. What we can say more, it came from Peru in 17th century and came to Spain, and from Spain, of course, spread all over the world.
Okay. How can we, as pet owners, be aware of what symptoms to look for in our pets when it comes to distemper?
Yes, this is actually a very important question, because first symptoms, it's the 3, 4, 5 days fever, what the owner cannot notice or very rare notice, because the temperature of the dog is between 38 and 39.5, and our temperature is much lower. Unless we check the temperature, yes, we can see that it's the higher above 39.5. Doesn't mean we can say that it's fever. Another symptoms in this time, it's sometimes anorexia, but it's not necessary, not always. After this time, after 3, 4, 6 days, the fever stop, and it's 6 days break, and then it's coming the second wave of fever with very severe symptoms. It's nasal discharge, it's purulent ocular discharge, it's sneezing, coughing, fatigue, lethargic. This is the main from respiratory system. Symptoms as well from gastrointestinal system. We have diarrhea with blood, vomiting. And as well dermatology, it's hyperkeratosis. It's the disease. It's very characteristic. After a few days, it shows up as well. It's heart valve disease. After 10, 14 days, it's possible that this is coming the second version, the neurological version. The virus wants to destroy the nervous system of our pet. And it starts with muscles twitching, with salivating, with seizures, paralysis, with chewing gum feet. It's the movement of the mandibula as well, very characteristic, with head tilt, and on the end, encephalomyelitis. And with this kind of symptoms, it's very difficult to fight. And we can say that this kind of symptoms are very severe and very mortal. We can say that we cannot guarantee if the animal can make it. Exactly.
Is there any way we can prevent our pets from catching distemper?
The best way to prevent the animal from catching the distemper and another viral diseases is proper immunization from early age. And we have exactly 2 ways. We can start very, very early, from 6 weeks old, and repeat 2 boosters in interval 3-4 weeks, or what is most common from 8 weeks, 9 weeks, and starter, and after 3-4 weeks we repeat the booster. But it's as well not finished, because we are sure that our animal is very protected, and sometimes not, because it depends how the body reacts on the vaccine, if the immune system produces enough of the antibodies against this diseases or disease. That's why we need to make, after last booster, we need to make vaccine check. Vaccine check is some kind of specific test. It's an antibody test that shows how many antibodies your animal has against the diseases, against distemper, against parvovirus, and against hepatitis. And if is the results sufficient, we are happy. Our animal is our pet is protected, and next vaccination will be after 1 year, because I need to say that yearly it's necessary. Yearly make the vaccination against the infection diseases for sure. And if it's insufficient, we need to in the same day or next day make the vaccination, and after 3-4 weeks again to check.
Is there anything that we can do to treat it? Is there a treatment for distemper?
Unfortunately, it's not specific treatment for distemper. We can only treat and help, treat the secondary bacterial infection. That's the broad spectrum of the antibiotics, hydration, electrolytes, parenteral food as well, nutrition, I can say, as well, analgesic, painkillers. Of course, this everything in the hospital. Antiemetic, anti-vomiting medication, yes, it's necessary to give it in some cases, and of course special care, because this kind of disease necessary have special care in the hospital. It's impossible to treat the animal with this severe symptoms at home.
That's actually great tips. Actually, very good to know. Is there anything that pet owners can be doing on a practical standpoint?
Yes, I think that as well, reduce a bit socialization. A bit, I don't say completely, don't panic, but reduce. And of course, because the transfer of this disease is from the aerosol droplets from the infected animal, sneezing, coughing, spitting, sniffing even. This is possible. From surfaces, from sharing the food, from sharing the water, from even if you're talking about the puppies, it's possible that the mother via placenta transfer the disease. And don't let the animal, our pet eat outside, chewing the grass.
Yeah.
This is because you don't know if before him any animal, for example, licked this.
Yeah. Okay, so those are actually very practical ways to ensure that we keep them safe.
Yeah, this is important. Better prevent.
Better prevent. Prevention is always better.
Yes.
That's so true. So one of the questions we've been receiving from our community is, if they are in a house with a dog that has distemper, can humans and cats in the house catch it too?
No, definitely no. Cat cannot catch, but we need to be as well, human as well, no? But human can transfer the distemper even on the clothes or hands or body to another dog. That's why if we visit some suspicious, dogs or kennels, we should immediately change the clothes and take shower and don't touch our dog.
Okay, until we
are completely clean.
Yeah.
Yes, this is important.
That makes perfect sense. Another question that we've had is regarding how active or how long the virus will stay active on certain surfaces.
It depends on the temperature. In the hot temperature, it's can be few hours only, but in the temperature quite lower, it can be few weeks, and in the soil 1 year.
How often should we clean our house, or
at least cleaning the house should be in this stage, should be every day, daily, and it's of course with disinfectant, quite safe for animals.
Thank you so much for joining us. Thank you, Dr. Magda, for being part of our discussion today.
Thank you.
Is there anything else you'd like to add?
Yes, I would like to add that the most important is vaccination, proper vaccination from early age, and of course it will have impact on the older animals as well, but proper vaccination, this is most important what we can do for our pet.
Amazing. Yes, prevention is always better than cure.
Of course.
Remember. Thank you so much again. If you have any questions at all about distemper or anything else, please feel free to follow us on Instagram for more updates. If you have any questions about distemper in particular, you can ask them in the comments, and we'll have Dr. Magda answer them for you. Thank you again, and
Thank you. Thank you. See you soon.
thanks for watching.